Hi, it's Sheila Martin of HappyHysterectomy.com, and in this second video of the Hysterectomy Quick Tip series, we're going to look at some of the most common conditions or symptoms and some possible alternatives to a hysterectomy that you can discuss with your doctor. So very quickly, we're going to look at the most common conditions that would cause a woman to have a hysterectomy, and we'll start with uterine fibroids, endometriosis, uterine prolapse, abnormal uterine bleeding, pelvic pain, adhesions and infection, and finally cancer. So we'll start with fibroids, and fibroids are actually the most common reason for a woman to have a hysterectomy. Fibroid is an abnormal growth of the uterine muscle, and it's typically not cancerous. So you want to ask your doctor about myomectomy, which is a much simpler procedure, and also a newer procedure, uterine artery embolization, or UAE, a lot easier to say. For endometriosis, probably the second most common reason for having a hysterectomy. It typically affects women of childbearing age, and it can cause pain and or infertility, so it's something you really want to look at. And you want to ask your doctor about pain medication and hormones and some more conservative surgery, which doesn't actually remove the essential organs. Uterine prolapse. This is a weakness of the pelvic support muscles, and it typically comes about through childbirth and also aging. So you want to ask your doctor about biofeedback and behavioral therapies. Pessary, which is a mechanical muscle support, and surgical procedures specific to you. So in other words, surgeries that are not quite as dramatic as a hysterectomy. Abnormal bleeding. Now this is obviously not a condition, but it's a symptom, so your first goal is to find out the cause of the bleeding. And you want to ask your doctor about a hysteroscopy, which will probably be used to evaluate your condition, but maybe always also to treat it. Endometrial ablation and progestin therapy. This could be oral or IUD. Pelvic problems. Your doctor will probably recommend a laparoscopy for diagnosis. And for pelvic infections, these will be typically treated with antibiotics. And pelvic adhesions, laparoscopy, boy, these names may be the best solution. And adenomyosis, for that, a hysterectomy is often the best solution. Cancer. Everyone worries about this, but actually only 11% of hysterectomies are for cancer, and it may be uterine, cervical, or ovarian. And in this case, you want to ask your doctor about radiation therapy. Okay, that's it for this quick tips video number 2, and learn more about your hysterectomy and watch the other videos. Go now to happyhysterectomy.com. We'll talk soon.